When people think about a hair transplant, they usually focus on one thing: how will my new hairline look? But there's another important question: what happens to the hair in the donor area? If you're considering FUE or FUT, you may wonder if the donor area will look thinner, whether the hair grows back, or if you can run out of donor hair. Today, we're breaking down what happens to your donor hair before, during, and after a transplant. Welcome to Root Hair Clinic. The donor area is where hair follicles are taken for transplantation. For many patients, this is the back and sides of the scalp because these areas are generally more resistant to androgenetic hair loss. But remember, your donor area is a limited resource. Proper planning is essential to achieve natural results while preserving your future donor supply. With FUE, individual follicular units are removed using a small punch, leaving small extraction sites that heal over time. Once a follicle is extracted, it no longer produces hair in its original location. Taking too many grafts from one area can cause visible thinning known as overharvesting. With FUT, a strip of skin containing follicular units is removed, the grafts are separated for transplantation, and the donor area is closed, leaving a linear scar that can often be concealed by surrounding hair.
Before we continue, please visit roothairtransplant.com for more information.
So, does donor hair grow back? The extracted follicle won't grow back in its original location because it has been moved. However, the surrounding donor hair remains. A good transplant doesn't just focus on the hair you're moving today, it also protects the hair you'll need tomorrow. After surgery, redness, scabs, and temporary changes in appearance are normal. How thin the donor area looks depends on the number of grafts taken, extraction density, original donor density, hair characteristics, and surgical technique. Can you run out of donor hair? Potentially, yes. Hair transplantation should be viewed as a long-term plan because hair loss can continue. Taking too many grafts may reduce the supply available for future procedures. That's why more grafts isn't always better. Strategic planning is better. Protecting your donor area starts with proper assessment, careful extraction, appropriate spacing, and following your clinic's aftercare instructions. Your donor area is part of your long-term hair restoration strategy. The best hair transplant isn't about asking, how many grafts can we take? It's about asking, how can we restore your hair while protecting your donor area for the future? If you're considering FUE, FUT, or another hair restoration option, a personalized assessment is the best place to start. At Root Hair Clinic, we look beyond today's hairline to create a treatment plan focused on your long-term hair restoration goals.